Hello, I'm Dr. Alina Fong from Cognitive FX. Navigating mental health issues after concussions can be frustrating and daunting. You are not alone if you have experienced worry, anxiety, even some post-traumatic stress disorder, feeling just not yourself, having a personality change after a concussion. And if you haven't noticed it, maybe family members or loved ones or friends close to you may have mentioned something to you. This is all very common. In fact, over 80% of the patients that we see at Cognitive FX have experienced some type of a change in their mood, whether again that's just feeling a little more nervous or worried or anxious than before, to clinically meeting the criteria for depression or post-traumatic stress disorder, even in some cases OCD. We just want to normalize this for you at this point in time and talk about what causes some of these changes, what changes you can expect, and what you can possibly do about them. Some of the common mental health struggles that someone with a concussion can experience are depression, anxiety, PTSD, as well as more of an overall change in personality and what we call emotional lability or dysregulation of your emotions. With depression, often patients will feel this sense of what we call anhedonia, or this lack of interest in really doing anything that they used to enjoy. They may isolate, they may have changes in their eating habits, and just overall feel down, sad, and withdrawn. One of the concerns that we have with depression at Cognitive FX, of course, is suicidal ideation. If you feel at risk for hurting yourself, hurting others, if you're thinking about suicide quite a bit, if you are desiring to hurt yourself and you have a plan and you have the means, we strongly encourage you to reach out to someone close to you, talk to your doctor, or even call the National Suicide Prevention Hotline, which is listed in the blog that accompanies this video. There is more than one kind of anxiety after a head injury. For some, it can be quite situational, where specific events might trigger some of this worry. In other times, you may actually have an anxiety disorder where you ruminate and you're very hypervigilant. Some of the other common symptoms that patients will report is feeling edgy, worrying uncontrollably, feeling uncomfortable, and maybe even having your stomach in knots. Sometimes your anxiety can manifest physically too. Some of our patients experience post-traumatic stress disorder or PTSD. For example, I can think of a patient earlier on in my practice who was a young man who was driving his prom date and himself to the prom and was involved in a severe accident. His prom date, his girlfriend, actually passed away in the accident, and he struggled significantly, not just with the concussion symptoms, but with post-traumatic stress disorder, feelings of depression, guilt, and anxiety. If you have been involved in a TBI and are also struggling with PTSD, it is very important for you to share that with someone, to be able to get the help you need, because that can also contribute to a long-term recovery. So the sooner you can get help and reach out to people, the better. Often these symptoms can result from a number of different factors. One, it could be a combination of the way that your brain communicates. Secondly, it could be some disruption or dysregulation in your autonomic nervous system. And thirdly, it could just be your brain's way of processing physical trauma. With a traumatic event, a concussion, a head injury, the brain's ability to metabolize glucose and oxygen effectively and efficiently is impaired. This is commonly known as neurovascular uncoupling or neurovascular dysregulation. Interestingly enough, these changes are not captured on structural imaging. So you may have MRIs and CTs that look completely normal. One example that I like to use is a car. You can lift the hood up of a car and see that everything is there and everything can look shiny and new. But when you close the hood and you stick the key in the ignition and it doesn't turn on, you know that there's an actual functional problem. So even though structurally that car looks beautiful and perfect, because that car doesn't turn on, you know that functionally something's not connected correctly. So in summary, your brain can look totally fine, but really be struggling to function on a day-to-day level. Some other symptoms of post-concussion syndrome that can also affect your emotional functioning is sleep. If you're not getting adequate and proper amounts of sleep, your tendency towards emotional distress will increase significantly. Chronic pain, headaches, physical pain in neck, back, shoulders, and head can also exacerbate or increase our propensity for emotional distress. Hormone dysregulation can also be a factor here, as well as dysautonomia, which I spoke of before. Because these emotional symptoms after concussions are so common, there are some wonderful treatment options for these types of symptoms for anyone struggling after a concussion. Now, first of all, there are many medications that are available. Medication is often recommended by doctors, but often in the case of post-concussion syndrome, may not always treat the root of the problem. In fact, in many of our patients at Cognitive FX, these medications can cause side effects or maybe even have interactions with each other that may exacerbate some symptoms that we're trying to treat. Although in some cases medications are completely appropriate, we tend at CFX to try other types of therapy routes. If you have been prescribed medications for anxiety or depression by your doctor and you really don't feel like it's helping, please speak up. Advocate for yourself and talk to your doctor about some other options. At Cognitive FX, we have our patients engage in psychotherapy. We have several PhD clinical psychologists here at our clinic that will help patients with cognitive behavioral therapy, CBT, and other types of non-medication interventions to help with identifying some triggers for anxiety, identifying some of the symptoms for depression, but managing them in a more natural way. Please remember that it is very normal to be experiencing these types of feelings and worries and concerns and to have mental health issues after a concussion. You are not crazy, as some of my patients sometimes say they feel. This is an absolutely normal part of the process. Every brain heals differently. Every brain takes its own time to recover. Just keep working at it. And if there's anything we can do to help you at CFX, click on the link below and we'll be happy to have a consult with you. For more information on this topic specifically, please feel free to click on the link below. That will take you to the blog that accompanies this video. Thank you.